they aren't able to identify that it's linked to anxiety or anxiety-related struggles. And, if I just dial back a lot and make it really small, even going back to stuff like when you're anxious about giving a college, what is it called? Vivas. Oof, horrible. So when you're waiting outside the door, I still have a very distinct, just waiting in line to give a viva, and that anxiety that some of us could feel, not everybody, and you can actually feel your stomach churning, you start feeling like you're going to vomit, or there's a lot of coughing that starts to happen. So you realize at a very basic level that mind and body are very, very interconnected. And the impact is going to happen both ways. And because I've trained in movement psychotherapy also, that's one of the premise, the basic premise of the work we do, is that you also work on healing the body. So how do you utilize the body to both understand emotional impacts of psychological struggle or distress, and also looking at transforming the body to then transform psychological distress and struggle, and not just focus on our thoughts or our emotions. That also, of course, but since I'm talking from a movement-based perspective, I focus on that. Anything, do you want me to elaborate further, or should we go to everybody and then?
Yes, we'll go to everybody. So thank you for answering that from the movement-based perspective. We asked Dr. Chinu. Yes, ma'am.
So we have to first understand that emotions and body together form a system. And so we have researchers by the name of psychoimmunoendocrinology, where this is a whole system of the psyche, the body represented by the nervous system and the endocrine system, both contributing to our immunology. And when we look at the body of researchers, this kind of premise that you are picking up for the discussion today has been a very old premise. We find researchers right from 1933 on this topic. And now we have a complete system of psychology, that is clinical health psychology, dedicated to this. Right. Where we are asserting, where we are exploring, where we are finding out how our emotions affect our body. And we have researchers which say that bottled up emotions cause specific disorders. Like, for example, sadness and anxiety, if they are not expressed, they may manifest in asthma.
Right.
If we have anger and hostility which is not expressed, which doesn't get an expression through our mind, it will get manifested as hypertension and cardiovascular diseases. We have gastrointestinal problems like peptic ulcers, which are directly linked to bottled up emotions.
Absolutely.
And so it is very evident through the research that we have that emotions are playing a very important role in the manifestation of physical symptoms. Now, one important point over here is, so emotions, when we talk about the research, there are many parallel factors in emotions which are being researched. Mm-hmm. One of them is emotional regulation. So there are 2 points at which you can manipulate or regulate your emotion. One is at the point of input. So for example, there is a stressful situation which you are encountering.
Ma'am, I'm so sorry to stop you here, but we do have a question dedicated to this explanation. Okay. Because we really want to understand here right now is that, is it causing,
It is causing.
Yes. So your answer on that research base, on that strong research base and a clinical health psychology field related to it proves that yes, our body is feeling the emotion and telling us how we are feeling by showing what we are feeling, right? So Dr. Radhika, what are your views on this question?
Yeah, I just have a few things to maybe supplement. It's not something to add to what was said earlier. See, basically, when you look at psychology and psychotherapy, you look at psychoanalysis, which is the father of psychotherapy. And psychoanalysis is the theory, psychoanalytic theory was basically born out of clients coming in with somatic body symptoms for which there was no physiological cause. And then Freud looked at it and thought about it, and then, just came to this presumption that, it's probably not physiological, there is something else. So it is psychosomatic. That means for the somatic, which is the body, there is a psychological cause. And if you look at it, it was, I don't want to go too much into this, but then if you look at the history, that was the time when a lot of women were coming in and the men were at war. So when you look at it contextually, this was what was happening. They were separated from their men. They had a lot of anxiety and fear and all these things, which were showing up as a lot of somatic symptoms.
Right.
So now today, that is history, a little bit of history. But today, when you look at it, when we say that a healthy mind resides in a healthy body, it's the other way around also. So a healthy body resides in a healthy mind. And therefore, I said, I just wanted to supplement what the other had said. So if you look at every single body system, whether you take the respiratory system, the cardiovascular system, the neurological system, the endocrinal system, the musculoskeletal system, the gastrointestinal. So you take everything, you see that is affected by stress or anxiety. And very nicely, someone earlier said that there are specific emotional, difficulties that are related to specific problems. Thank you so much. That's a great learning for me. I must look into it a little bit more. But when I see it, today when you talk about psychoendocrinology, when you look at that, diabetes used to be an inherited thing. So people used to say, okay, nobody in my family has it, I don't have it. But today that's not the case. India is the diabetic capital of the world. And if you look at that, there is stress diabetes. The people who are getting diabetes when they're 28, 29, 30, 35. So, when you look at it, it's stress diabetes. Arthritis used to come up at 55, 60, old people's disease. It's not so. So we have stress arthritis. And of course, hypertension, the cardiovascular system, like, hypertension, your high BP, cholesterol, all these things, and leading up to heart attack. Neurological system, leading up to trauma, can lead up to stroke.
Right.
The respiratory system, allergies, asthmas, common cold, stress related. No, skin, dermatology, every single thing can be related to stress. Your eczema and your vitiligo, psoriasis, everything. So every system in your body, if you look at gastrointestinal system, we don't even have to talk about it. Your ulcers and your, acidities and all those things. So every single system in our body is affected by our emotions. But here I want to talk about one thing. Everybody talks about emotion as distress alone. But it's not so. There is a stress on the body which is called eustress, which is feeling exhilarated all the time.
Right.
That also is not good for the system. So the body doesn't think that, okay, this is good stress and bad stress, this is pleasant stress. No. If you are emotional and your emotionality is very high, whether it is in a positive direction or in a negative direction, that's why people who are on these drugs and, maybe narcotic drugs, psychiatric drugs, or something else, even sleeping, what happens is it affects the body. It affects your neurotransmitters.
Right.
And there's a lot to be spoken about it.
Absolutely. So this is one of the most least talked about topics, but this is one of the most important topics to address, so that people understand, and also a fraternity of doctors or psychologists understand that it's not about competition between a physician can deal this, or a cardiologist can deal this, or
Yes.
a psychologist can deal this. It's about a teamwork. It's more about working together. And that's very important to, then it comes, very important to understand this aspect of what causes physical distress. Is there an emotional distress that is causing physical distress? So coming to my second question on this is that, many people who come to psychologists have been to various physicians and doctors of different specialities, and they have, certain complaints of headache and back pain and breathing issues or skin issues, like the experts mentioned right now. So do you think, or are there research evidence that are these because of suppressed emotional issues, or are these because of, very fresh emotions? So is it something which is traumatic or maybe suppressed in the childhood, or is it more about recent effects? So what is it about? And we begin by Dr. Radhika, where we ended.
Okay, so first thing I would like to tell you, if we have a great number of people here watching, and as a counselor who's been practicing for so many years, when you said people come to the psychologist because they've gone to the physicians, that very rarely happens.
Right.
Unless they are referred by the physician, unless they've been told by the physician that, look, there doesn't seem to be anything wrong, physically, physiologically wrong with you, I think you need to address this. But not many physicians actually say that. They just say there doesn't seem to be any cause, we don't know, maybe it is stress, and they will leave it there. They won't even think that, look, it has come to a point where this person's stress has gone to the other realm of physiology. I mean, how stressful should it be when it is not felt by the heart but felt by the body and is being expressed by the body?
Absolutely.
So this is something that every lay person should understand, that it's important, if I go and I have something which is not explained by medical causes, then maybe I should go to somebody who will help me that way.
Absolutely.
Having said that, if I am feeling the stress, psychology is all about that, right? It's about opening your unconscious, it's opening your awareness and directing it towards attending to those feelings, identifying those feelings, looking at the emotional triggers, identifying the patterns. That's what psychotherapy is all about. Any therapy is all about that. So if I am feeling it, I am going to be expressing it. I'm going to be talking to somebody, somewhere along the way, I'm going to be expressing it. But if I push it inside, I'm not suppressing it, but like in psychoanalysis, we say repressing it. It's an unconscious process of pushing it down.
Right.
Just ignoring it and just repressing it, pushing it down, where it bulges out. I don't know where to go. The stress says that I don't know where to go. I am just here and I'm building up, the pressure is building up, so let me just go and attack the stomach or the intestine or the heart so it's about that.
You say it's both. It's it works both ways, and it's not just suppressed emotions or repressed emotions, like you say. It's actually both emotions, depending upon the severity and the acceptance level.
Yes.
Dr. Chinu, what do you say on this?
So, emotions, they affect our body is already established by the earlier answer. Now we need to understand, the question is that whether it is old emotions or whether they are fresh or new emotions that are affecting. Every emotion that is generated is related to our nervous system and endocrinological system, whether it is the old emotion or the new emotion, irrespective of anything. So for example, if you are feeling angry right now, your body will also react. So you will have palpitations in the heart, you will have your muscles tensed up, you will have all those effects in your body as well. So the body, now there are certain things which we need to understand, that is about the constitution of the person. There are people who are highly sensitive people, whom we call as HSPs. These HSPs, their arousal system is very, very sensitive. So a small amount of stressor is going to affect them very badly in their body. And so they will develop lots of things, even with fresh and new emotions. Some people, they will be able to handle emotions, regulate emotions in a more better way. And that was what I was trying to say earlier, that there are two parts of the emotional regulation system. One is at the input and one is at the output. When you are able to adjust to the emotion at the input level, then it is constructive regulation, where you are interpreting or restructuring the situation in such a way that it is not affecting you. And you are able to curtail it at the input level itself. But when the emotion has entered and you are now trying to regulate it at the output level, where you are not allowing yourself to express it the way you should, when you are not ready to talk about it, when you are not ready to give an outlet to your emotion, at that level, it will affect the body severely.
Okay. Okay. All right. Thank you, ma'am, for answering that. Aditi.
So what I'm going to do is, since I think it's very, very well established in terms of the scientific basis of it, I'm going to switch and give you an example of a client I worked with. So this was a 10.5-year-old when the person came to me, and had, at that point we didn't know, but had experienced sexual abuse and violence in a small city in a hospital ICU after a surgical procedure had been completed by a doctor and a nurse. And she came in I think about a year after this had happened, and hadn't been going to school, had developed significant somatic issues. So she came in on a wheelchair, though nothing was wrong with her feet, wasn't talking, and the parents kept saying she's tongue-tied, her tongue gets twisted, and she just doesn't talk when she's in a situation that makes her anxious. She doesn't feel like she can move her limbs. She's constantly nervous, looking down, doesn't make eye contact, starts creating sounds when someone, comes towards her. And as we worked with her, slowly realized that there was also a lot of regression that happened when she eventually did start opening up. When I had used a lot of art, with visual art here, not movement, that what Dr. Radhika was talking about for her was that a lot had been repressed because this young child went through a very difficult experience and potentially dissociated from that space and repressed a lot of the trauma and the emotion which she couldn't process at that point. So this is, highlighting what you're saying in terms of previous trauma that is either we're unable to deal with. So there's a fight, flight, or freeze response that happens with trauma. And very often with children or people stuck in traumatic situations who cannot understand or process the situation, freeze is what happens because they can't run, they can't escape, and they can't fight it at that point. And what I did with her was a lot of work initially using visual art. So just moving across the table, picking up paint. She wouldn't talk, she was tongue-tied. Small things like reaching out for paint, creating what she liked on paper, from her animals to music to different things. As we progressed, and we never actually talked about the issue at hand because again, her defenses were strong. She wasn't ready. It was manifesting in her body for a reason. The mind couldn't handle it, right? And I think that's also something we realize as we work with client bases. There's a reason that it manifests so much. That sometimes our mind is just not ready to handle or process the scale of what it's been through. It's sometimes easier for the body to kind of take it on and we don't realize. So it took about 6 months till she finally spoke about it. And it happened through a combination of art and movement. And I don't want to get into too much detail. I don't think we'll have time. But when she finally did, it was in this image that she created where she had just chucked paint and she was moving. So there was a lot of body work involved. And she just started crying because the images, the symbols, which is often how we store trauma or large-scale stressors, especially when we're younger or when we're pre-verbal, so when you're very, very young and haven't developed language to process your struggle. You code it in your implicit memory, which is your memory, which is non-verbal, right? And art and movement become a very, very powerful way to utilize that to allow for expression, which is what Dr. Chinu and Dr. Radhika said, gets stuck, that we aren't able to express, resolve what we're struggling with, or sometimes even have insight around it. I And the second part of it, Astha, is also that, yes, there are also a lot of situations where fresh crisis or struggle or anxiety or a pattern that a human being has. So it's not always just something has to happen. It's also a personality that we develop, whether it's early attachment issues or because of how we are as a person, which has come out of all our experiences that, have happened through the course of our life. So it could also be our way of looking at things. So a lot of people often call themselves, they say that, oh, I'm a very OC person. And again, this is not about being diagnosed with OCD, but, people say that, yeah, I'm very particular about this, or I'm very worried about this. So you also often find that, like Dr. Chinu mentioned, that specific struggles will lead to also potentially specific physiological struggle or distress. And, you can look at it. It will be very interesting to go through casework and to understand when you actually see it manifest, it can be that strong. And if I could give you an image of this child, and that's just one of, I know, hundreds that, between the three of us we would have seen, was that she couldn't move. And there was no scan, no physical evidence of anything. And, like you, Aastha, rightly said, that sometimes, even now, because I work in a hospital, that even now we have people, and I think Dr. Radhika said rightly, so that often physicians even then don't refer. They just, they're stressing, or they'll self-medicate. They won't refer to a psychiatrist, which is also very, very problematic. So I also feel like, but still people do come through the rigmarole of getting a series of documents, and they'll walk in and say, you know what, we can't understand, stomach check kar liya, MRI kar liya, 1, 2, 3, 4, and kuch nahi nikla. So what is going on? And yeah, I think
and also when they come in and, they show you their files and they will be like, see this, I did everything and it's still not working.
Yes.
To help me. And, they place that last trust on you. And when they actually find that solution with you and not with everybody else, it's actually, that aha, that is created for them. So that's really wonderful. But I guess we as professionals need to work really hard to establish our position in actually the whole of medical fraternity, so that they trust us for whatever we are doing. Dr. Radhika, you want to say something?
I just had to, I think a part of your question was, do new trauma and old trauma, you were talking about that.
Yes.
I just want to address that because I addressed the old trauma.
Right.
So when we're talking, it's important that when you are going through a new trauma, unless it is an extreme immediate trauma, people, it gradually builds up in people. And the new trauma is not the first thing. The new trauma doesn't say, okay, let me go and attack the body. It is felt by the heart.
Right.
So you feel the anxiety, you feel nervous, you feel afraid, you feel all these things, you do feel, and somewhere along the way you probably talk here, you talk there, but not because you don't talk to a professional, you don't get it. But once it just keeps adding up and adding up and adding up, that's when it really starts attacking the body. But yes, when we feel emotions, our bodies also react.
Absolutely. Yes, agreed. And to our participants, if you have any questions, disagreements, agreements to whatever we are talking about, please feel free to put it in chat, because it's very important that we make it discussion based and, not one-sided, so that we also learn from you, we also get to know a new perspective from your work area and your work background. So that's very important. And coming to my third question, and we have actually discussed now about physicians or other specialty doctors who who say that अरे stress है, कुछ नहीं है, जाओ यहाँ पे कुछ नहीं है मेरे पास आपके लिए, right? So they also end up giving such medications or just to satisfy their patient or their client. Do these medicines act as placebos? Because they might, make the client feel okay, make the patient feel okay, and then the patient will not ever come back and will not have addressed the issue. Or on the other hand, it might, end up making the patient worse. So how does it work like? Do you think it works as a placebo, or is it more about, not working on anything? Dr. Chinu.
So, Aastha, one of the answers to your question is most often the doctors themselves are not aware about the existence of psychosis, psychosomatic basis of illnesses. And
Yes.
hence, they are just keeping on blindly treating their patients on the basis of the symptoms being presented. And one of the things that the patients don't realize is that if the, so there are many angles to this question actually. One kind of a thing is, which we have been talking about since the session started, is dissociative disorder kind of a thing, where the subconscious mind has taken over and it has become the driver, and the symptoms have been, manifested in the body without the awareness of the patient itself, the patient himself or herself. And the other thing is when the patient is, so I have seen so many cases, especially of women, where they are not getting any kind of attention in the family unless they complain of some headache or some low back pain. And then the husband would spend time with them and take her to the doctor. And I have had a lady who was being treated by different kinds of doctors for so many years without any relief. And what she would say is, my symptoms are real and your medicines are not working. Rather than developing an insight that there might be something which I need to address at. So she would just keep changing the doctor from one doctor to the other, and the way you said, with the files around. So placebos will work on one kind of patients, but they won't work on other kinds of patients.
Right. Absolutely.
Where the agenda of the subconscious mind is to maintain the problem rather than to come out of it. Right. In that case, even the placebos are not going to work.
Right. So do we also establish this kind of rapport, maybe that placebos could work on recent emotions and not repressed emotions? Or is it not, will it be about one approach fits all? So we cannot classify that.
No, it's not about recent or old emotions. It's more about the disorder that has,
Right.
So I will give you an example from the book, the book of surgery that we used to study in the medical college, that is called as Love and Bailey. The authors are Love and Bailey, where we have this example of Munchausen syndrome.
Mm-hmm.
Where the client would read everything on the internet and he would come to the surgeon's office and say that I have got this pain exactly over here, and he will manifest, so for example, if he manifests appendicitis.
Right.
The surgeon is made to believe that there is actually appendicitis, whereas there is nothing wrong with the client. There is a joke which our teacher used to tell us about this, that एक बार एक पेशेंट आया और उसने बोला कि ऐसे डॉक्टर साहब मेरे पेट में घोड़ा दौड़ता है, टुक 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 टुक. So the doctor said कि ये तो वैसे किससे भी ठीक नहीं होने वाला है, तो मंचाउसन सिंड्रोम है, जब तक सर्जरी नहीं हो जाएगी तब तक ये ठीक नहीं होने वाला है. So they planned a fake surgery. So they took him to the OT and they said कि चलो इसकी सर्जरी करते हैं. और ऐसी पट्टी वट्टी लगा दी और कर दिया, और एक घोड़ा जो था ट्रे में उसको दिखा दिया कि देखो घोड़ा निकाल लिया हमने तुम्हारे पेट से. So he looks at the horse and he says, पर डॉक्टर साहब ये तो काला घोड़ा है, मेरे पेट में तो सफेद घोड़ा. So if the agenda is to maintain the disease, your placebo is not going to work.
Right.
As simple as that.
Absolutely, absolutely. What do you say, Aditi, for this?
So I think at a basic level, if medicines are being given, let's say something's manifested as a headache or as back pain, and chances are they will medicate for headache and back pain, and that it's not a placebo in that it might work for one symptom. But it won't work for very long, and it'll come back after whatever course of medication they're given, and eventually that's why people go around to multiple people and eventually hopefully make it to a therapist who can actually help them with what's going on, because again, it's not that necessarily they're giving a placebo to be like, these people are not understanding anything. The doctors also enjoy medicating, so they will medicate. And unfortunately, if someone actually needs medication, which means that the client needs psychiatric support, and there is a neurotransmitter imbalance which needs to be rectified along with psychotherapy, that kind of medication might make sense where it's required. But this isn't that kind of medication, right? This is to treat the symptom that's been brought in. So it might temporarily treat the symptom, but it will come back, or it will re-manifest in some other form, or it will show itself in another light until what's actually at hand is expressed, processed, treated, or the person learns to regulate their emotions, or whatever it is that's actually at the core of their struggle.
Absolutely. So thank you for addressing that. And so I was thinking about a conversation one day, Dr. Radhika, where you mentioned that you visit a medical hospital as well, a medical college as well, right?
Yes.
And we just talked about one thing, that physicians themselves do not know that there are psychosomatic problems happening. Second, doctors enjoy giving medications, right? So you meet students who are pursuing MBBS, MD, medical field, becoming doctors. What do you think of your experience in talking to them? How do they react to these things, or our profession?
That's a great question. That actually I wanted to start off with that. Because I visit many medical colleges and teach behavioral medicine and things like that. So I basically teach them psychology, bedside manners and all that. But when you look at it, MCI, Medical Council of India, is the only board which does not have psychology in its curriculum. Dentists have, I teach dental students, I teach physiotherapy, nursing students, occupational. So every other medical based, physiological based curriculum has psychology in it. But they don't have, they don't have psychology in medical. This has been my fight. So whenever I go there, I always say, okay, I will teach your dental students, but I need to talk to your medical students also, MBBS first years. I want them to know how important it is to know that the mind has a mind of its own, and they cannot just deal with the body. So this is something that I've been really fighting. And we have a couple of colleges here, Savita University and Ramachandra, who decided to take up the thing. And because they are private universities, they don't come under government university. They have, and I have, made a curriculum for the medical students. But even then, the other doctors are such that the other professors, they don't give it importance. So the students come, they don't even learn much. They come and it's like an optional class. They're not serious about it, and then things like that. So that's a very difficult situation. But coming again to this topic about whether they will be treated, yes, if they have symptoms, their symptoms will be alleviated by all these painkillers and everything. And what happens is, the more medication they take, and they feel better after it. Their migraine goes away, headache goes away, stomach ache goes away, all these things. They start to depend on these medicines, because the physician, no one tells them that, look, this is not the cause. I'm just treating, whatever is there on top. So you need to look. So every time you go, there are people who go like a picnic to take a drip. Today I'm going, this is my monthly drip. So they just go and they take saline water, IV, and then come.
Right.
And they are actually pampered by the doctors to do that. I know quite a few people who actually do that. And then when people go, second thing, when people go, they are not doctors if they don't give injections. So when people go, they need an injection. It has nothing to do with rural, urban, educated, uneducated, nothing. You go to a doctor, you need an injection. You are not a doctor if you don't give an injection.
Right. So this is a very...
I want to add one thing over here, Aastha.
Yeah.
If you take away the psychosomatic illnesses from the physicians, you would actually be taking away 70% of their practice. And even the gastroenterologists and all these things, they're thriving on psychosomatic illnesses.
Yeah.
You tell them don't treat them, who will they treat?
Absolutely.
It's self-preservation, and then they just create more and more addictions, to NSAIDs and all these things. It's really sad. People get addicted. So if you go, just give them a Neurobion. Neurobion is the cheapest medicine that you can find, 8 rupees per thing, So you just give it. It's not going to affect. It's not going to create anything positive. It's not going to create anything negative. So take it. So it's a placebo.
Right.
But they become dependent on it. And if they don't get it, their symptoms start all over again, and they become much more pronounced.
Absolutely.
Than before they started. That is the danger of this.
I have a tiny example now, because I think what you said, I think there's such a lack of knowledge that I had this client eventually come to me. Both parents were doctors, and actually later, once he finally came in, was diagnosed with OCD and struggling with a range of personality issues, but just been on tramadol, which is an extremely powerful painkiller. For years, he'd just been and he said, in his own words, popping tramadol because it's the only thing, that keeps me feeling okay. Otherwise, I'm in complete pain and agony and I can't handle it.
Yes.
And just the parents didn't know. It wasn't that they were trying to drug their child, but they were doctors. And in their head, they were like, okay, pain getting worse, pain getting even worse. Let's fix it like this.
Right. So it's if we talk about this in very harsh terms, it's all about money minting business and not actually helping the client. Now,
yes.
Earlier in the day, we also connected Dr. Natasha from Mumbai. She's an MD psychiatrist, and we were talking about how psychologists and psychiatrists should work together as a team, because it's very important not to demean each other and not to establish a rapport of superiority or inferiority in working. But I guess now when we have this panel discussion, it's actually about the whole medical fraternity and the whole psychological fraternity to work together and establish that rapport, that this is your case and this is my case. Just like a cancer patient would not go to a cardiologist for having cancer. He would go to an oncologist. So that's very important. So thank you.
Aastha, the thing is that the fraternity is a very hard nut to crack.
Yeah.
You will have to accept that. And being a member of NABH, that is National Accreditation Board of Hospitals, we try to, talk to doctors about certain small things like how should you break bad news to patients? How should you give quality to your interaction with the patients? Even for things like this, there is no receptivity. Wherein they would feel that, they know everything because they know how to write some medicines. One. So what is the answer? The answer is to bring this awareness to the community and the public. And that's what I mean when I say that psychology is for everyone. Don't keep psychology for your patients, for the clinical population. Take psychology to general people.
Yes.
Talk about this to people in general so that they start understanding that if I have got this, where is it that I have to go? Because they end up going to the physicians and wrong doctors because they are not aware. Once we make them aware and we make a psychologist a safer place to go to, then you will start getting direct footfalls.
Right.
Expect the scene to change in the fraternity too soon.
Absolutely.
So it is positively changing. And you know that now we have got so many psychiatrists attending Feeling Minds programs.
Right. So it
is changing, but it is not going to change overnight.
It's not like a top-down approach. It's like a bottoms-up approach.
Bottoms-up approach.
Where you
stop seeing it as the top.
Sorry, where?
I said I think you have to stop seeing that as the top in any case. I think that's also something that's so ingrained in us. But I had this one thought, because I have been working with the hospital for 8 years. And I think one of the things I realized is there's a gap in how we're trained in psychology also. The majority of psychologists don't talk clinically. So you have a lot of psychologists, when they speak to a doctor or when they are, talking to somebody in the medical field, they're speaking in very layman terms. And if we're not able to connect the medical clinical knowledge that psychology has to offer, like all the panelists are doing, what I realize is the medical professionals shut down, and then they go back into that box of thinking that these guys don't know anything. So I think what I've learned over the 8 years of working, and now we have a 50-member psychological team across Fortis, and we work with physicians, we work in the chemo ward, so they call us in, we work to do bereavement work, and if someone loses somebody, they actually call us in to work with the doctor to give the news. So a lot of these things we've managed to just scrape at the surface, but I realize it also depends on how we're able to communicate. How do I show somebody that art therapy or psychotherapy or CBT are relevant and are making an impact, and I can share my details or discussions or changes scientifically to a certain degree with you and speak your language as well. Because I also realize that when I work with students or when I train students, there's a huge gap in the language that students are using to talk about psychology, which kind of diminishes what we do. Right. So I also feel that that's another change that we need to make.
I think the change all at the education perspective, where psychology needs to be established science in India, because it is already there in abroad. So it needs to be an established science in India, so that, it does not belong to a humanistic or humanities perspective. So yes, we talk in psychology about human behavior, about human mind, but then we also talk about psychology as a science, and to include that in the scientific field is very important. So like, for example, I had a science background in 11th and 12th, and then I pursued psychology. So I think that kind of helped me to get that, biological perspective towards psychology. But people who are doing humanities and then coming in for psychology lack that perspective. So when I talk to students, it's actually what I can also feel, and what you're saying, Aditi, is absolutely correct. So they see us like, ठीक है, just because we lack that basic knowledge of terms and of words, we are doing well, but we are not using their terms, and they are not using our terms. So there's this disparity of connection. So moving on, we have like very less time left, and this conversation is never ending. This is like a debate. If we had medical people here, and it would have turned into a debate, and this is a never ending topic. But I would just address one question that has come up. If migraine is psychosomatic, how to deal with it without medication? And I know I've heard Dr. Chinu speaking about it in length. So I would request you, ma'am, to answer this very quickly.
So migraine is not psychosomatic completely. Migraine is a vascular headache. It has to be diagnosed properly to understand whether it is tension headache or migraine. If it is a vascular headache, you'll have to take medicines and precautions. But if it is a tension headache, then psychotherapy will help you.
Right. Okay. And one more question was how to deal with psychosomatic problem. Okay. So this is a long one. How to handle stress, personal stress to which your health is affected. You are doing meditation and everything, but it's not working out. So how do we handle that psychosomatic problem? Because the maintaining cause is still there. And I think, ma'am, your question here, Dr. Reena, your question must have been answered that it's very important to cater to your emotions. And if you are a psychologist, does not mean you do not need another psychologist. So you can go to your colleague or your psychologist and figure out that, what's causing trouble, what's the maintaining cause that you're talking about. Because ऐसा नहीं होगा कि अगर एक कार्डियोलॉजिस्ट को हार्ट अटैक आ जाएगा तो वो बोलेगा मैं ही अपना ट्रीटमेंट करूंगा, वो भी तो दूसरे कार्डियोलॉजिस्ट के पास जाएगा. So it's okay when we teach people that it's okay to talk about emotions. Why can't we as professionals talk about our emotions? So Dr. Reena is a homeopathic doctor. Dr. Chinu.
I'll just remind Dr. Reena about the thing that I said, that we have to learn to process the emotions at the input level.
Right.
अगर वो प्रोसेसिंग हम सीख गए ना, वही प्रोसेसिंग बहुत सारी साइकोथेरेपी में सिखाई जाती है. RECBT में और CBT में तो हाइपोथेसिस ही ये है that it is not the situation but what you think about the situation that is affecting you.
Right.
So if this is brought to general public, we don't wait for somebody to get into depression to come to us. We take this philosophy to them, we teach them, and then they will be able to process their stress. So Dr. Reena, for giving an example, let us say, आप कहीं गए मॉल में और आपको कोई आपकी बहुत अच्छी फ्रेंड मिल गई और आप उसको देख के बड़ी एक्साइटेड हुए और आपने उसको हाय किया, पर उसने आपको देख के भी वापस से हाय नहीं किया. अब आप उदास हो गई, अब आपको नहीं अच्छा लग रहा है बिल्कुल भी, आप बिना शॉपिंग अपनी कंप्लीट किए घर पे चली गई. अब आप सोचने लगी कि उसने क्यों मुझे वापस से हाय नहीं किया, क्या गड़बड़ हो गई, एंड यू फील लाइक क्राइंग एंड ऑल दोज फिजियोलॉजिकल सिम्टम्स आल्सो कम अप. If that input situation where a person did not greet you back was processed in a different way, where you allowed your mind to give you alternate explanations to that situation, then that emotion would not have affected you like this. So for example, if you would have said कि क्या पता मेरी फ्रेंड थी या मुझे ऐसा लगा, क्योंकि अगर होती तो शायद वो ग्रीट करती, या फिर क्या पता उसने मुझे देखा ही नहीं, क्या पता उसने देख के मुझे पहचाना नहीं, क्या पता उसकी खुद की कुछ स्ट्रेस हो जिसकी वजह से वो चली गई, या आप उसको घर आके फोन करके पूछ लेते कि कहाँ है तू, मुझे दिखी थी. इनपुट लेवल पे इमोशन आपने process.
You're talking about rationalizing emotions, which is one most important aspect of CBT, RECBT, ma'am, like you established right now. And you actually answered the last question that we are about to ask, that how do we...
Can I just come in just a minute?
Sure.
So when you say how to handle stress and personal stress, which your health is affected, and you're doing meditation and everything. See, when you don't know what affects you, then it's going to be very difficult to handle that. Meditation is for general serenity, calmness, peacefulness in life, right? It's bringing down your emotionality. But then if you want to actually target your stress, the first thing you need to do is attend to your feelings. So one of the very practical things I say is, I myself have this hourly chime on my phone, and every hour it chimes and I say, okay, now is the time to think. So more than meditation, mindfulness is something that really helps. Right. So think about what you're feeling without judging, but give attention to that feeling and see whether, what is this you're feeling. Then why are you feeling that? What is the emotional trigger? Right? So once you start attending to your feelings, today I feel, now I'm feeling this, and okay, why is it I'm feeling uncomfortable? Like, Dr. Chinu said, okay, she didn't smile at me. So what? So what is it that I'm feeling uncomfortable about? Right? So the moment you start identifying that, then you will start seeing certain patterns. Okay, when something like this happens, it's, my emotions can be triggered.
Right, absolutely.
And then you become attentive. So mindfulness is the thing that...
Absolutely, yes, right. So we majorly wanted to talk about 3 approaches, as we have 3 experts here, of different backgrounds, of different approaches, practicing different approaches. And we want to just take up, and this will actually answer the recent questions that have been coming from Lavanya and from Shiv Kumar, is that how do we identify first a disorder which is coming like a physical distress, but it's actually emotional, and second, how do we deal with it? So like just now Dr. Chinu said, rationalizing your emotion is what, works on the premise of RECBT, but there will be more and we will open the stage. So first we would like to go with Aditi. So Aditi, how does art therapy or expressive art therapy works towards this?
So two things. I think we won't actually be able to get into techniques of each space in the next 10 minutes. But I do think everyone who's asking questions or just जिसको लग रहा है कि हम लोग stress, struggle के through गुजर रहे हैं और समझ नहीं आ रहा, किसी से बात नहीं कर पा रहे, support नहीं ले पा रहे, there are a whole host of experts that are available. You have 4 people on this chat and I guess quite a few more also, and others around, and helplines, and lots of other spaces जहाँ पे आप बात कर सकते हो. And I know it's not easy, and I know मुश्किल है to decide to reach out and take that step. But अगर बात नहीं कर पा रहे और किसी से, चाहे वो friends हो, चाहे family हो, चाहे जो भी हो, find a way to try and reach out to someone, anyone that you feel comfortable reaching out to, because your first step, whether it's art therapy, whether it's psychoanalysis, CBT, whatever it is, will be to decide to reach out. Will be to decide that मुझे मदद की जरूरत है. And आसान नहीं होता, and clear भी नहीं होता. But अगर हम GP के पास जा सकते हैं, we can go to, do XYZ 10 things, and sure enough, we can also reach out to someone for this support. It's creating that much havoc that you are realizing that your body is breaking down. So it's not bad enough that the mind is in pain, the body is also collapsing.
Right.
So I think that's one, that, beyond this next 10 minutes, I think it would make sense for people to actually reach out. As far as art therapy is concerned, when you look at expressive art-based therapy, it's essentially using an umbrella. So we use a combination of movement, music, writing, storytelling, play, visual art, which is drawing and painting. And a lot of the roots of expressive arts therapy are in analytical work. And then they move into cognitive and solution-focused work as well as paradigms to utilize this. So the identification of struggle or disorders or diagnosis or stressors or presenting symptoms would come through in 2 ways. One is in the clinical interview when we're actually talking to you and we're able to identify symptoms you're bringing up, which would be the presenting concerns, and then also through your artwork. So it will also reflect in the process of how you create art, what materials you choose, how apprehensive you are, what you actually create, what the content of your creation means to you. So if I've made something, what does that mean to me? How do I explain it? What projections have I made on it? And slowly and steadily, we unearth a lot of material that's potentially repressed. We start making sense of it. There are various cognitive techniques we bring in towards a later stage in treatment to look at transformation. So it's very hard to explain in a nutshell, but yeah, it's a combination of utilizing your creative expression, and which is what essentially connects both parts of our brain. So your left and right brain actually wake up if I put electrodes on your head, we'll see it light up when you create art. And it's about bridging that. And I think I forgot the question, but the identification is essentially a combination of the clinical interview and what comes up in the process of your movement or your art, and for the therapist to work with you to establish goals and identify your struggles and build insight again with you over time. Because the therapist is some jadugar who knows everything about you by looking at you. So they will also develop clarity as it comes to you with them.
Right.
Also, when you come to why one cannot speak one's thoughts and feelings, the point is we are not used to speaking our thoughts and feelings. And when people come to me, like probably when people came to Freud, they had to be taught to speak their feelings. It doesn't come easy to everybody. We think as psychologists, we say, why don't you talk about your, feelings? What are you thinking? Tell me your process. But it's not easy. So we have clients who come and sit down, and that's probably why art also works extremely well, because you don't require them to talk. But then when they come, because I'm not an art therapist, I have to train them. Okay, there are leading questions that I have to ask. What is it? What are you thinking now? Talk a little bit more. It takes for somebody who, like she said, I can't speak out my thoughts and feelings. It requires practice. So why don't you just go and practice in front of the mirror? You don't have to have somebody else. This is the safest and securest way, most secure way of beginning to, it requires practice. So just 2 minutes, go to that place, go look at yourself in the mirror, think that the mirror is a different one. Or you can have a gestalt, a technique where, you have a chair in front of you and you think that that chair is something, whoever that you want to talk to, maybe your friend or your parents or siblings or anything. You can imagine somebody sitting there and just talk for 2 minutes. Just keep a stop clock for 2 minutes and then say, okay, this is what I am feeling. This is what I am thinking. This is what, maybe you don't start with this is what I'm feeling, this is what I'm thinking. Maybe you just start with this is what happened today.
Right.
I'm a little bit uncomfortable. It requires practice because not everybody is able to talk.
You established a very good point that we are not taught to talk about emotions.
We're not.
Like, just
One thing that such people can start with is journaling. They can write
Journaling
down.
is a good, yes.
And now we have a few apps like diary apps where you can even write on your phone.
Mhm.
And these diaries, they have got secure locks and self-raising systems and all. So they can be used for coming out with your inner core and thoughts.
Right.
Or a plain notebook will do.
Yes.
The age-old diary writing. Just pick up a diary and write.
This is like Aditi has mentioned on chat. This is a very old technique which is given by Dr. James.
Yes.
And people do use that, but we are not taught to use that. Like as children, we bring those colorful diaries and those log and talewali diary, but that is just for fun. We are not actually taught what to write in it and how to express. So just for an example, I had a client, 27-year-old male, who I gave him a paper and a color box, and he chose white color to draw on a white paper. How is that even visible? It was the first session. So that got me thinking. This is the reason why people are ashamed of even showing in their artwork that what they are feeling. And he was constantly saying, please mujhe judge mat karna, please mujhe judge mat karna. So this behavior, this is very, very common. And how do you deal with it in a psychoanalytic or a neo-psychoanalytic perspective, Dr. Radhika?
See, like I said, Freud had to actually teach the people, his clients, to free associate.
Right.
Free association means you come, you lie down on the couch, and you say anything that comes to your mind. Try doing that. I don't think any one of us can do that very easily.
Right.
Because right from the beginning, we are taught to edit.
Right.
Don't say this, don't do this. When you're children and somebody falls, it's very funny. And a child laughs, no, you're not supposed to laugh. Things like that. So right from the beginning, we're taught this social etiquette. And in the name of social etiquette, we teach people to keep on editing. So what happens is, am I saying the right thing? What is this person going to think? These are the constant things that keep in my mind. I'm constantly feeling judged.
Absolutely.
Whether that person is judging me or not. So what we do is, whether it's psychoanalytic or human, in talking therapy, is when the client, men find it much more difficult to talk than women.
Right.
There is that man-woman difference also. We don't know whether they're wired. It's only because they're wired differently, like John Gray says, or is it because they have been taught? Men have been taught. You're supposed to be manly. You're not supposed to talk. You're not supposed to do this. And don't be a sissy. Don't be a woman. Things like that. So the first thing that we need to do is start it. Maybe you can start off with a journal, because that's the least thing. But if you're not able to write, if you don't want to write, then start speaking.
Right.
And it takes practice. But then speak to yourself first. Speaking in your mind is not speaking.
Not helping.
Mind voice is not speaking.
Right.
So you have to say the words aloud.
Yeah. Keeping your words at a distance from your own self.
Yes. You have to say them. You have to say them aloud. And when you say them aloud, the calmness, the instant, the pressure, it goes down.
Right.
Once you say the words aloud. Supposing I say, I am afraid. It's on in my mind. I'm afraid. But then when I speak it aloud to the mirror or something, I'm really scared.
Right.
That is like pricking that balloon, it just deflates.
Right.
And it makes you feel very light.
Absolutely.
Speaking aloud is important. It requires practice. Just go ahead, start today.
Thank you. Thank you so much. So
And you started daily diary writing? That's amazing. That's amazing. Read them out. Read it out.
right.
You see the words, you speak it out.
Right. So last closing something from Chinu ma'am. When people come to you and they are not able to talk, how do you rationalize that using your specialty and your techniques?
So first thing is that I would make a slight correction. It is not rationalizing the emotions. Emotions are emotions. You cannot rationalize them. It's rationalizing the beliefs that you are holding.
Right.
And the beliefs won't come in the first instance. What the client comes to you is with the situation and with the emotion. बहुत भयंकर situation में मैं हूँ. So they cannot just stop talking about the situation. So we have got specific protocols for educating the client about the cognitive model, which we gradually take the client to,
Right.
and to help them realize that there is something underlying that we need to talk about, and that is how we help. And the thing that I would not like to miss out is helping the client trust on you. Creating that safe space, building that kind of a rapport, whether it is any therapy. Unless the client feels safe with you, nothing is going to come out.
Right. Right. Absolutely.
Like your client said, don't judge me, don't judge me. Because they have been judged so much that they suspect that, the therapist is also forming an opinion about them.
Absolutely. Absolutely. So thank you for establishing that. And today's discussion has been really fruitful. So we established quite a few things in just 1 hour's time where, we did establish that physical distresses are caused by underlying emotions. And, no matter how heavy or how light emotions are, or how situation specific or age specific they do matter. They do matter. It is just person to person. So there cannot be an established rapport of how will they matter, right? And for everybody, there will be a feedback form popping up on your screen. You just have to fill in if this session was useful to you or not. And this is completely anonymous. So if you say no, we are okay. We just get a scope for improvement. So that's okay. And thank you for joining in, experts. And thank you for, educating us about your certain techniques, your therapeutic background, and about also opening a discussion of why is there this, disparity between the medical field and the psychological field. So thank you for that. And
Aastha, congratulations on completing 4 years at MpowerU.
2 years.
2 years, okay. And wish you all the best in all your future endeavors. And very soon, you already know that I'm very keen to learn art-based therapy from you. And let us see when you will adjust that time for me.
Anytime, ma'am. Anytime for you. Thank you so much. Thank you. Thank you.
Thank you.
Thank you, Aditi.
Thank you, Aastha. I have attended your workshops, and that's how actually we came to know about each other. Amazing workshops.
Ma'am, thank you so much. Thank you. So thank you everybody for attending, and bye-bye. See you very, very soon.
Bye.
Thank you so much, ma'am. Thank you.
Thank you, Deepika.
A very informative session, ma'am.
Thank you, Kritika. I hope we stay connected.
Thank you, ma'am.
Yeah, thank you so much.
Thank you, ma'am. Thank you, sir. Thank you, Aarti.
It was excellent. Yeah, it was excellent. And I was just listening only because cannot write this so early. It is difficult to write. So I was just listening to it, and your earlier session also I have attended, but it is very good and a very good initiative you are taking, all of you, the youngsters.